Welcome to the COVID-19 Crisis Response Zoom event. This is to discuss the urgent humanitarian support for Uganda. This is live on Zoom, and I am Patricia Baby Amawa from Afroglobal Television and Silver Trust Media. We have a great program, and the highlights are as follows. First, we hear from Susan Namulindua, the founder and director of Mama Waterley in Africa Trade Desk. The program vision and mission will be shared by Moses A. Mawa, president of Afroglobal Television, Silver Trust Media, and the Transformation Institute. The overview of the COVID-19 crisis in Uganda will be shared by Dr. Daniel Shabanze, epidemiologist and head of the Uganda COVID-19 Task Force. The impact of COVID-19 on the healthcare system will be shared by Dr. Richard Idro, president of the Uganda Medical Association. We'll hear a message from the Ugandan High Commission in Ottawa, presented by Ambassador Margaret Chojire, Chargée d'Affaires. The challenges of COVID-19 and how it can be defeated is a message that will be shared by Dr. Don Kilby, founder of Canada Africa Community Health Alliance. Now, COVID-19 has taken a remarkable hero, Reverend Sister Mary Proscovia. Jimmy Sebulime, founder of the Agnes Zabali Boys and Girls Club, will share a message about her legacy. Treatment and coping for those who are affected by COVID-19 is a message that will be shared by Dr. Ben Thompson, who is a physician and associate professor of medicine at Queen's University. How the pandemic has affected the community and the need to support the cost of oxygen machines is a message that will be shared by Ronnie Mayanja, Uganda Diaspora Network journalist and entrepreneur. The short and long-term impact of the coronavirus and a call to action will be presented by Dr. Ivan Edwards, a lieutenant colonel and flight surgeon at the United States Air Force. Now, we'll begin with a welcome message by Susan Namulindua, the founder and director of Mama Waterley in Africa Trade Desk.
Hello, everybody. Good afternoon, good evening, good morning. It gives me great pleasure to welcome everybody today. I wish the circumstances were different, but here we are. At this point, we are in this thing for over a year and a half. And we are all tired. We have had COVID this, COVID that, and I am blessed to be Ugandan, but also blessed to be in Ottawa. Here in Ottawa, we are thinking summer, the lockdown is over, we can go outside. This past week, we are a bit more free to go and do whatever. But most importantly, we are vaccinated. My family members and I have taken both our shots, and if we wanted to get on a plane or to go do anything right now, we can do that. That is not the case in Uganda. The other item I can highlight is if by any chance we had gotten sick here, we can go to the hospital and be sure that everything that we need for our care is available for the doctors to try to save our lives. I have family in Uganda. I have lost some in this third wave. I have family in Uganda and friends in Uganda that have had to pay or even take their savings from NSSF to pay for the care of their family members and still lose the family members, leaving the family without the breadwinners, without the savings, and most importantly, without their loved ones. This afternoon, this conversation is not about proving to anybody that COVID is real. It is real. I still have family members that are recovering from it. And it is not to answer any questions about what is going to happen to this if we do this or whatever, or to try to answer questions of who is going to handle these machines or whatever. That is not the purpose of this conversation today. Today we are here to try to save as many lives as we can. We have a panel of experts that is going to help us not only to understand the immediate need or the immediate steps that we can take, but the far-reaching implications of even after somebody has had COVID and recovered, what can they expect? I do believe that my job is the easiest, and I'm going to step out of the way. But before I do that, I want to express my sincere gratitude to all the panelists. All the people on this call are busy people. Not that there's anybody, even if you're not busy, your time is still precious. An hour of time is an hour of time. For our participants, for our panelists, thank you for taking this time to join us for this conversation. And when this conversation is done, the work still needs to be done. So please reach out, share the materials that are going to be shared today, share the information so other people can join in and be able to assist to achieve the goal that we have set of getting 200 oxygen concentrators in the hands of referral hospitals, in the hands of remote hospitals, so that we can save lives now, and also because the machines will stay even after COVID is done, to continue saving lives with that. With that, I'm going to send it back to you, Patricia. Thank you, everybody, for being here today. Stay safe, and thank you for being here.
Thank you very much, Susan. Yeah, you did say there that you've lost some family members and you have some who are recovering. It is real. I'm also part of a Ugandan family, by marriage, and I've heard news of even someone who traveled from the diaspora to Uganda for a funeral, caught COVID, died, and then her mom also died. So 3 members of the family within a very short time. So this is real. Now, to share the program's vision and mission, I would like to invite Moses A. Mawa, President, Transformation Institute, Afroglobal Television, and Silver Trust Media.
Thank you so much, Patricia, and I am so delighted to be able to share this day with you to really look at ways and means to try and improve the situation that's going on, the things that are going on in Uganda. The national hospitals are currently overwhelmed due to the rapid spread of the coronavirus. The lack of oxygen and breathing equipment is the most urgent need to be addressed in order to save lives. ICU capacity, rapid testing kits, PPEs for staff members, and many other needs are growing daily. Various COVID strains, including the ones from the UK, India, and South Africa, are now in the country, and the disease is actually spreading fast. The saddest thing is that as much as in Canada, the United States, and some other countries, we have so much in terms of vaccines, Uganda has almost none. And even frontline workers really need vaccines, but they do not have enough actually to go around. In fact, in just a few days, about 8 medical doctors died of COVID, and 3 heads of department at Uganda's leading university, Makerere, succumbed to the disease. We have engineers and lawyers and business leaders and all kinds of people, who have actually died as a result of the disease. We can imagine the impact of this pandemic actually on the future because of the brain drain. This is not brain drain about people leaving, going somewhere, potentially coming back, but people who are actually dying. So the situation is actually quite dire. And that is why the Uganda COVID-19 Support Network, which is essentially a group of concerned Ugandans and friends of Uganda with the humanitarian mandate to mobilize help to address the crisis, has essentially come together. Among these, we have Mama Watali and the Transformation Institute for Leadership and Innovation, the Uganda Diaspora Network, and a number of other organizations that have actually stepped forward actually to work with us to make this happen. We are also so delighted that we've had the opportunity to work with the Ugandan Embassy in Washington, D.C., and the Uganda High Commission here in Ottawa in Canada, who have actually worked with us quite closely, and we are also connecting with the various consuls that represent Uganda in our major cities in order for us to be able to ensure that the resources that we want to mobilize are actually, actualized. And we are reaching out to a number of entities in order to ensure that we are able to raise as much as $200,000 in order to send oxygen concentrators and potentially PPEs and other items as well to help the situation on the ground. The Uganda COVID-19 support network is encouraging also the government of Canada and the government of the United States, among others, to help with expediting the provision of vaccines in order to save lives. And we are pleased to actually let you know that a letter was actually sent to the Prime Minister of Canada, Justin Trudeau, and we did receive a response. And in that response, the Minister of International Development was copied, essentially encouraging that action be taken to support this request that has been made actually on behalf of the friends of Uganda and the Ugandans that are actually a part of this network. As members of the G7, Canada and the United States are urged to help with the expeditious bilateral as well as support through the multilateral COVAX system that is administered by the World Health Organization and other entities. So it is very, very important for us to make sure that the best is actually done. And later on, perhaps, Ronnie Mayanja is going to speak a little bit about the US Senate Majority Leader, Chuck Schumer, whom we are hoping will be able to assist as well based on certain relationships that are actually in place. And we trust that all will work out well. And then finally, I'd like to encourage that donations to the network be actually considered. Payments can be made to Mama Watali or to the Transformation Institute. And if it is actually given out to Mama Watali and there is need actually to ensure that there is tax receipts to be given, it is actually possible because Mama Watali works very closely with the Social Planning Council of Ottawa, a charity that has served Canadians actually for more than 90 years. And we have tremendous track record having actually had the opportunity to undertake projects, even on behalf of the government of Canada and the Canadian Red Cross. So both Mama Watali and the Transformation Institute have actually done so much that has been received very well, even by the Canadian government. So that's really all I would like to say at this time. And once again, thank you so very much for being a part of this important conversation. And let's make Uganda safer again. And, let's reach out independently, individually, but most importantly at this time, let's try and make sure that this goal of sending these life-saving oxygen concentrators is actually achieved. And I believe Dr. Kilby, a Canadian physician who has actually done a lot of work in Africa, will be able to perhaps speak a little bit about what these, oxygen concentrators can do. Even after COVID is gone, these are important equipment that will serve Ugandan hospitals in a very special way. And thank you very much.
Thank you so much, Moses. And if you're watching this program and you would like to support, please just do that, by following the information at the bottom of your screen to do so. To give us an overview of the COVID-19 crisis in Uganda, I would like to invite Dr. Daniel Chabanze, epidemiologist and head of the Uganda COVID-19 Task Force.
Thank you, Patricia, and thank you all who've tuned in to listen to this conversation. And thank you for having me here, Daniel Chabanze. I'm a physician in Uganda and also an epidemiologist and serving with the Ministry of Health. Just to highlight that we are now undergoing the second wave of the pandemic in Uganda. We had the earlier outbreak in March 2020, last year, and we're able to manage the COVID-19 numbers subside, but starting June this year, the numbers of the health system. So let me just walk you through to what we've been able to see, observe currently. The collective cumulative numbers have so far reached 92,795 people who have contracted the disease. And of those, currently we have 631 in critical care now. But so far, collectively, we've had a few recoveries. These about 78,415 people have been able to recover and gone home. Worryingly, so far, we've lost over 2,600 people. As of yesterday, we had 2,590 people who had been confirmed dead due to the COVID. And that's our sympathy and condolences to those who have lost their dear ones and those who still mourn their loved ones. We are looking at limited vaccines in the country. So far, we've had just over 1.5 million doses so far being offered to the country. And we've vaccinated 1,135,000 people with both the first and second doses. And in the current wave, our current wave, we've seen that that death rate has come to 15.5. Case fatality rate has come to 15.5 after adjusting. The good news is that we are now over the highest. The pandemic seemed to be receding, and apparently a reversal of the epidemiological trends, as we can currently see that we have reduced between May and June, where the peak, at the highest peak of the highest point of the peak, we are reporting about 1,700 patients per day as of 10th June. But in the last few days, we are seeing that we are reporting an average of 290 cases confirmed per day. These are still very many, and they're overwhelming the health system. That said, and as Moses mentioned earlier, is that the country has now been reported to have all these different strains reported in the country. We have the Alpha, which was a variant which was observed on 2nd February. We had Beta, February, and the Delta, which we call Indian variant, was seen on the 15th of April. And thereafter, we saw this severe surge in number of cases. But remember that we also had what we call the Ugandan variant, and we also have the local one named Nigeria, which is the other virus. The whole country is currently affected. Of all the 135 districts, cases are reported from all these different districts. And so we have all these district task force being initiated. And I do give support to the Greater Masaka Task Force, and that's where I oversee most of the support, including the one of the crossing point from Tanzania, a border point which still allows people to cross from the two countries. So on 6th May, the president had announced a major lockdown for 42 days, and that was to enhance or to try and make sure we enhance the measures to interrupt the transmission of the COVID-19, most especially among the health workers. As you've all noted, that once we lose a health worker, we've lost the human resource which would have helped guard the disease. So it's very important that we have the protective gear. Also, one of the aims of the lockdown was to make sure we enhance communication and also engage with community management. With the overwhelming number, we had also gone into home care management. And so home-based care had to be streamlined, and also to quickly vaccinate the people. Thank you very much. But just maybe before I stop, I need to tell you that we've had some successes. So far, we've been able to vaccinate people, and we're following up the vaccine side effects. And so far, we've reported 283, and that gives confidence to the people. The government of Uganda still expects to receive 2,806 vaccine doses of AstraZeneca in this current week. We also expect to receive 688,000 in the middle of August. We've also received the pledge from the People's Republic of China, end of July, 300,000 vaccines. So to date in the pipeline, in terms of vaccine, government has already paid and secured Johnson & Johnson vaccine, 2 million doses, which we think will be in the country shortly, and another 9 million doses to be received in the early part of 2020. That is only partially covering the 22 million people we target to vaccinate in the country. So all efforts for you people to speak with the different governments that you have access to will be required. So going forward, as we summarize, we have a few strategies to optimize our response. As I mentioned, we need to get adequate equipment, including the oxygen concentrators that you've talking about, supplies of commodities for the labs, the testing kits, the human resource to run all those different intensive care units. So we have a stretch on the human resource. We need to mobilize the whole citizenry in the response. Previously, people were not aware of the risk that they stand with the COVID because they thought it was only affecting a certain age group, the elderly. But with this current wave, we've seen that the variants are affecting everybody. Not to mention that the continuation of essential services. We don't want people to be prevented from catching COVID and then they end up dying with the normal diseases which have been in circulation because of their fear to go to the health facility. So there's been a revamping in the immediate emergency medical services with ambulances, with water, ambulances with boats, even with increasing the capacity of the cars. We have some lessons learned, and as I close my submission, is that we've been able to provide as a government the face masks to 36 million Ugandans, to provide PPE, and the leadership and the technical guidance being given by the panel is very welcome. I want to stand by quoting Mother Teresa. She said, "Your true character is most accurately measured by how you treat those who can do nothing for you." Thank you very much. And thank you, Patricia, for giving us the opportunity to talk to the people for God and my country.
Thank you so much, Dr. Chavanze, for that update. It is great to see that, your team and the government is doing a lot to address the situation. And all we can do is just to support that good work that's already going on. Moses said something the other day that empathy is humanity's love language. And I would like to reach out to all of us who are, human beings at this time. You may not be from Uganda or not even from Africa, but if you're watching this and you can reach out as one human being to another one, it will really be great. We have information about how you can support this, project by donating and helping to make sure that Ugandans have the equipment that they need, especially the oxygen concentrators. So make sure that you take part. The impact of COVID-19 on the healthcare system will be shared by Dr. Richard Idro, President of the Uganda Medical Association.
I am Dr. Richard Idro. I am a consultant pediatrician and a pediatric neurologist at Mulago National Referral Hospital in Uganda, and a senior lecturer in Makerere University, the premier medical school in the country. I also serve as the president of the Uganda Medical Association, which is the umbrella body for all doctors in the country. As doctors, our mission is the welfare and the professionalism of doctors in the country in a bid to offer quality health and quality health services to the population of Uganda. Currently, Uganda is in its second wave of COVID-19. The first wave, the first patient with COVID-19 was detected in this country in March of 2020. And during the first wave, most of the patients we had were generally presented mostly with mild cases. We had a few patients, relatively few with severe illness or with critical illness admitted to hospital. However, the mass in other parts of the world, the major containment measure initially was a period of lockdown. And then, of course, the standard operating procedures of wearing a mask, hand washing, the general containment measures. What has been grave has been this second wave, which started, I'll say, mostly at the end of April or early May this year, and is still going on. And until yesterday, the country had been in a lockdown. And what was different between the first wave, where the virus was probably the initial wild virus form, and what the current form is, where we mostly have the Delta variant, has been the severity of the disease, the magnitude, the numbers of infections, and even the people who have been affected. And it has been all across board, from children, adults, and the elderly. And the consequences have been very grave. In June, our health services were literally run down, completely overwhelmed. We will have ambulances lining up in emergency departments with no bed spaces where to take patients. We lost several individuals in ambulances as bed spaces were being created in different hospitals around the country. The disease was widespread from north to south, from east to west, and it spared no parts of the country. But more significantly, the effect of the disease on the health services and particularly the health workers was quite gross. In the last week of May and the first 3 weeks of June, we lost 16 doctors. In just a space of 4 weeks, we lost 16 doctors, amongst whom were very senior doctors, including consultant neurosurgeons, pediatricians, consultant surgeons, and ENT surgeon. And this, for example, the neurosurgeon was just one of 10 neurosurgeons we have in the country. The effect was devastating in terms of what it did, one, to the morale of the health workers, but also in the population. The few health workers were really stricken badly. We had over 3,000 health worker infections in a very short space, and this also diminished the number of people available to care for patients in the country. Now, this is coupled with a period of lockdown. So you have an impact on the health service, you have an impact on the health workers, but also because of the widespread, there was a lot of loss. Over 2,000 people died in a relatively short period. And some of them, many people died at home, some of them not necessarily attributed to COVID-19, and probably they will have, but also from other illnesses, because the other illnesses never stopped. Malaria infections did not stop, pneumonias did not stop, pregnancy-related complications had not stopped. And this affected the overall population. The mental health impact in the population was huge, but one of the worst effects to date is what has happened in adolescents. We have had so many thousands of teenage pregnancies during these 2 periods of lockdown. And with schools closed, we have so many girls getting pregnant. Many of the future of many of these girls may be affected, and the effects of this COVID-19 will be there for generations to be felt. Now, during this, specifically going back to the health service, one of the major factors which contributed to really the dire effects was oxygen production. In many of their hospitals, especially the regional referral hospitals, which were admitting patients with COVID, their oxygen production abilities were completely exceeded. And all around the country, even industrial oxygen from some industrial centers were shifted to producing medical oxygen, but this was completely inadequate to the needs of the available patients. Several people died needing oxygen. And so at that time, to date, one of the things which we really require is additional resources in producing oxygen. The portable oxygen concentrators, which can particularly be placed in the high dependence units in the regional referral hospitals, but also even in the general hospitals, in the smaller hospitals, in their HDUs, will really be one great thing to support these interventions in the country. In the long term, is vaccination, because that is really what is going to get us out of this mess. Currently, it is estimated we have about 21.9 million people, 18 years or older, and these are the people as a country we have elected to vaccinate in the first phase. But the vaccines are not there. To date, only 1.1 million out of the 21.9 million have received at least one dose of a vaccine. Yesterday, His Excellency the President announced the start of the easing of the lockdown. But as health workers, as doctors of the country, although we are in agreement with the initiative to start easing the lockdown, the worry is in the coming months, we may have the third wave coming. And unless the population is vaccinated, we will go back to where we are. And so our second call is really for vaccines. Our countries are having real challenges with accessing vaccines for the population. It will really be great if our population really receives this vaccine so that people go back to their duties, family heads go back to working and earning to take care of their families, children go back to school, teachers are able to teach in classrooms, and the health service goes back to work. But the only way of doing this is to have everyone who requires vaccination to be vaccinated.
Now, we'll have a message from the Ugandan High Commission in Ottawa. Representing the High Commission is Charge d'Affaires Ambassador Margaret Chojira. Welcome, ma'am.
Good afternoon, everyone. I bring you greetings from Uganda High Commission and condolences to those who have lost their loved ones to COVID. Only this week I was watching on YouTube a funeral of a young man in his 40s, and it's really heartbreaking. But I would also like to appreciate all the efforts that are being made at different levels to alleviate the effect of COVID-19 in Uganda. The Ugandans in the diaspora, the Friends of Uganda, you are doing a lot of work. Thank you so much. I think most of the times we hear about getting things like oxygen, all those big things, they are very important. But I think maybe we could also look a little bit more in educating people about COVID, because some people, I think, don't fully appreciate how bad COVID is, how real it really is. And that's why you find some people, they just carry on without wearing masks, or those who wear them, they are below the nose. And I think, to me, those are signs that we need to educate people a little bit more about COVID, because we need everybody to be careful. This is not something that is going to be overcome by the government or the medical workers. It's not. It needs everybody. Thank you very much, Dr. Chabanze. Now we are updated about what is happening in Uganda, the achievements of the government and where challenges lie, and so we know what to do. Thank you so much. Uganda High Commission is still following up with Global Affairs about assistance, and I'm sure when everything is in place, the information will be given out in due course. I think really all the scientists and whatnot are handling what is technical, but as I said, my concern is really sensitizing people to get them to know that COVID is for real, and also to get them to take SOPs seriously, not to look at them as something that is there to suppress some people. They are very difficult, they are not pleasant, but we are in this situation and we have to, accept that SOPs are definitely a must. There was something else I wanted to say, but I think it has escaped my mind. But yeah, and I would like everybody to treat COVID as the real problem. Sometimes there are tendencies to politicize COVID, but COVID is apolitical. And I think we all have to learn it, to understand that, and join hands in fighting COVID. I wish everybody very fruitful discussions, and I'm very hopeful that we shall get out of here with better ideas, better approaches, and I'm very, very grateful to those who have organized this meeting. Thank you so much, and may God give you health, and may God bless you.
Thank you so much, Ambassador Tojire, for those remarks. Now, I would love to introduce a very special man. He is a great ally of the community. I'll say that he's an honorary chief, African chief. He's done so much for Africa. And I had the privilege of meeting him a few years ago when we gave him an award here in Toronto for the great work that he's been doing for the continent. He'll be speaking about the challenges and how COVID-19 can be defeated. I would love to welcome Dr. Don Kilby, who's the founder of Canada Africa Community Health Alliance.
Thank you very much, Patricia, for the introduction, and thank you for the invitation, Moses and Margaret and Patricia, to join you here today, and to all the other panelists that are here. It really is a privilege for me to speak with you, and I really care deeply about this, this situation that we now find ourselves in around the world, and as we see in more resource limited settings where vaccination rollouts have been delayed, and where opportunities for care and treatment have not been the same as we have had in North America and Europe, where now this situation is at a point where this present wave in the pandemic, with the appearance of more aggressive variants, such as a Delta variant, are beginning to have a really serious impact. I want to echo the comments of Madam High Commissioner Margaret. I want to echo your comments and start to say this really is a multi-pronged approach. And I think that, we will not get through this if we do not deal with the education component that Margaret talks about. It is very, very important that everybody at the grassroots level, at the community level, that people in their homes and in their villages understand COVID, that they appreciate the implications of COVID. They appreciate the impact it can have, that they appreciate how it is transmitted. And that, that they be part of the commitment to, reducing the spread of COVID within their communities. I think that, the next step in our multi-pronged approach to this is to really adopt the public health measures that are required, that are needed in order to prevent the spread, so that we reduce the numbers of people that become infected, especially by these very virulent variants. We heard some of the epidemiology today, and we can sort of celebrate in some way the improvements that are being noted by the statistics that are being presented, that in fact there is a type of receding, if you would. The word used was a receding of this pandemic, that numbers may be improving. And I think we need to be able, again, to educate people, to help people to understand that when we see these numbers improving, that they are a result of the efforts that are made by each individual who does take the time to understand the importance that they, or the role that they play in transmission of this virus. And so that, we get the public, that we educate our families, and we educate the people in our villages, and we educate, those that are around us, of the importance of masking, of hand sanitation, of distancing, as very simple but very effective methods to reverse the trends of these rises in numbers that we see in the statistics that we have, and that we can explain to people that when we do see these numbers recede, that they are a result of the efforts of everyone to reduce the transmission through these simple public health measures. Having said that, we still need to address, and we still obviously need to deal with the shortages that we have everywhere within the healthcare structure, in terms of the support that is required for all the doctors and nurses and other essential workers that are working with people that are infected by COVID, that we have the testing that's available, that we have the medications, simple things like dexamethasone, that's very inexpensive, but is a cornerstone of the treatment of people who are hospitalized with this. And that, of course, the PPE that is going to be required to protect our staff, protect our essential workers, and again, to protect each other. The O2 supplies that we talk about, in terms of having, first of all, 100% oxygen available, because the 100% oxygen truly is the most life-saving source or type of oxygen that we need, but not to discount every other intermediary step to 100% oxygen that can be taken, and the efforts that are being made to try to acquire oxygen concentrators and other equipments that are going to ease the supply of oxygen that are needed for more serious cases, and support people to prevent them from becoming more seriously ill by using the oxygen concentrators that do not give 100% oxygen, but would raise the level of oxygen available to people and raise the level of oxygen in their blood. Patricia mentioned, I think at the beginning, that I might say something about, the use of these oxygen concentrators. They may not be machines that have been traditionally used in intensive care units, but they are machines that have been used and they're used throughout the healthcare system. And as we know, throughout Uganda, throughout many countries, where there is smoke inhalation, not as we know that North America is cigarettes, but even smoke inhalation from cooking, that people do suffer from chronic lung disease, and those chronic lung diseases often require the assistance of oxygenators, and that is where this equipment will likely be used for people who will suffer from chronic lung disease. Some of it post-COVID, but some of it related to other conditions. Again, the last prong of our multi-pronged effort is one of advocacy. And I think that this forum today and people speaking out today have a role of not only educating each other and educating others, but also we have a role in playing in order to have that advocacy role towards, all the to wherever we can advocate for more support, more funding, and more collaboration to ensure that these supplies reach those areas where people need it the most. So thank you very much for giving me this opportunity. I truly appreciate it, and appreciate being on this call with all of you.
Thank you so much, Dr. Kilby, and we appreciate all the great work that you continue to do for the continent. We are so privileged to have you on this program today. Now, our next speaker is going to be, speaking about a hero that we've lost at this time. It is really unfortunate that we lost Reverend Sister Mary Proskovia and Jimmy Sebolima, founder of the Agnes Zabili Boys and Girls Club, shares information about her legacy.
For educating me and for being here. It's not fair that I get to speak after my dear friend and father figure, Dr. Don Kilby, but I'll do my best. Sister Mary Proskovia is a Ugandan who partnered with Canada African Health Alliance to do a medical mission or medical camp in Uganda for the last 14 years. She is someone, when you talk of education, she was someone who stepped in. It's a huge void and a huge loss. And almost 3.5 weeks ago, she went to bury her father just to make sure he was buried with dignity and respect. And she ended up getting sick there. And she's like, Jimmy, I'll be okay. I'll just go to the hospital. And she ended up going to Masaka, Nkozi, and then she ended up in Zambia Hospital. And then I got the phone call that she had lost her life. She was 49 years old, somebody who understood what partnership is, somebody who was compassionate, very competent, who was very proud to be a nurse/midwife. But not only that, she shared her skills with young Ugandans. And now she's gone, a huge void. When you speak of education, I'm at loss. I'm very sad about losing her because she was the one who helped me provide education at the Boys and Girls Club, and she showed up every day, whenever she can. She took her role very serious, and now she's gone. And this is why I've dedicated myself working with Dr. Kilby and Dr. Ben Thompson to do what we can to support you guys and to continue supporting our partners in Uganda at Nkozi Hospital and Guli Health Centers. So we're doing our part, but we're a small organization. And so working with you guys opens doors for us, but we could support you in any way we can. Please let me know. And again, thank you for having me here. And thank you for caring about Ugandans. And looking forward to learning more from everyone on this panel. Thank you very much.
Thank you so much, Jimmy. And we pray that the soul of Reverend Sister Mary Proskovia will rest in perfect peace. Now, the treatment and the coping, mechanism for COVID-19 are not the same here in Canada compared to Uganda, for instance. Someone said that COVID is not an equal opportunity disease, and that is true. The other day, I heard in the news that Canada now has enough vaccine to vaccinate its entire population. Yet some countries in Africa are still, struggling to get vaccines in arms, and there are no equipment. People are just dying, people that would have lived, which is really sad. But to give us a bit more information about treatment and coping with COVID, I would like to invite Dr. Ben Thompson, who is a physician and associate professor of medicine at Queen's University. Welcome, Dr. Thompson.
Thank you for the opportunity for being part of this panel. I wanted first to just point out, I think it's really important we identify the impressive efforts that Dr. Daniel and Dr. Richard have put forward. Uganda, in many ways, has been an example of what should be done to prepare for a COVID epidemic, and is in many ways was well prepared compared to plenty of its neighbors, in large part due to the great efforts of Dr. Daniel and Dr. Richard. And we see a parallel between the experience in Uganda and the experience in Canada, where we initially focused a lot of our resources in assuring that some of our most vulnerable populations would be vaccinated first. And we focused specifically on the Indigenous populations, where it was very difficult or even potentially impractical to have some of the public health measures enforced in those communities. And when those communities were vaccinated first, we noticed that there has been a significant reduction in the impact of COVID-19 in these communities. But even despite these efforts, we are now having Indigenous communities that are very severely impacted by COVID-19. And this is really a parallel with what we're seeing in Uganda. Our most vulnerable people are being impacted first. So as a physician in Canada, I was confronted with COVID. Many of my colleagues who were physicians were themselves COVID infected. We had a number of physicians in Canada who passed away. Thankfully, physicians were able to get vaccinated quickly, and that was less of a situation as in places such as Italy or Greece, where it was a much worse situation. Certainly more of a parallel there than to what's happening in Uganda now. But I think we should probably go back to what Dr. Kilby says. This is really, we're going to overcome this with a multi-pronged approach. It's not just vaccination. It's not just medications. It's not just having the right medical supplies. It's also making sure we have the right information getting to the public. When we had the Indigenous communities vaccinated, it wasn't just a matter of showing up with vaccines. It was a matter of having the right information provided to the Indigenous people before we arrived, making sure that their community leaders were engaged, making sure that we had the logistics really, really well identified to assure that we could go in and that the people were welcoming and wanting of this intervention. So, I mean, again, to reinforce what Dr. Kilby said, the oxygen concentrators are very important. When I was in Ngozi Hospital in Uganda in 2018, I saw a 60-year-old gentleman named Moses who came in with his daughter, very short of breath, with a great deal of difficulty breathing. And oxygen was not available for this man. He probably would have survived had oxygen been available. So it again goes to the fact that, yes, we're dealing with a pandemic, but the equipment that we're purchasing here, that's so important, will also serve a function well after the COVID pandemic has passed us. So this is very, very important that this is supported, these oxygen concentrators. But this is only one part of the COVID response. And so, with Dr. Daniel and Dr. Richard's expertise, we'll still need the other public health interventions with regards to masking, social distancing, washing hands, making sure that the appropriate education is provided to all the people so that they're not only willing but wanting of vaccination and the public health efforts. So thank you again so much for being for bringing this together. I really hope that together we can identify some meaningful interventions that will help overcome COVID in Uganda.
Thank you so much, Dr. Thompson, for those remarks. Now, I would like to call on a very important man. He runs a very amazing organization that is one of the, the pivotal organizations in the diaspora regarding Uganda. He is the founder of Ugandan Diaspora Network. He's also a journalist and an entrepreneur. It's my pleasure to welcome Ronnie Mayanja to speak about how the pandemic has affected the community and the need to support the cause for oxygen machines to be sent to Uganda. Ronnie?
Thank you so much, Patricia, and thank you so much, Moses, for spearheading this campaign. I also recognize all the panelists present. Thank you so much, Susan, for everything you've done thus far as well with Mama Watali. Yeah, I just wanted to say a couple of things about this experience. For me, it starts home. As a matter of fact, Dr. Chabainze being one of the people leading the COVID task force back in Uganda was one of the people I reached out to when my sister told me that the husband was battling for his life, that is with COVID. And eventually, knowing Dr. Chabayinze, having gone to school and he being a classmate from Bundo, I thought that this was something that we had in every way, I would probably say, control, that we were going to come out of it on the other side. Long story short, after 6 weeks, my brother-in-law did perish again as a result of COVID. He was on ventilation, on life support. And this, for me, affected us as a family. While he was in hospital, my sister reached out because at some point they had given so much money. The final bill, to put it plainly, was 200 million. And I'm talking about people you would probably say part of the Ugandan middle class, because he owns a travel company which brings in tourists from Germany. But to feel that they also had reached their tail end just because of how the business of tourism had been battered was something that was tough to deal with. And then eventually, of course, I had that very, late night call from Dr. Chabayinze, who was also very instrumental in helping us during that whole entire time, that I think, the organs of my brother-in-law had been affected. But why do I share that story to whoever might be watching at this particular time? COVID is real. Some people thought it was a hoax. I still see people who don't even believe in the whole vaccination process as a whole. I think it's high time that we do what we can. Again, the people back home have been affected adversely. I've lost up to 4 close relatives in a space of 2 weeks to COVID. So it's real, and the bills and so many other things that it leaves behind, is in its wake is just terrible. So when Moses reached out to me, I thought, what can I do? First of all, I felt a little flattered, but I said, hey, we have to step up to the plate. One of the things I did mention was try to get people that I knew could do something. And of course, as we had our meetings, they were trying to reach certain people within the Ministry of Health and then others. So during our initial call, I reached out to the ambassador in Washington. I reached out to the ambassador in Ottawa. I reached out to Margaret and to see how we could basically be able to help. So long story again short is that I'm glad that all these people were very positive in trying to see what we could do to mitigate the situation. And over the course of the last several weeks, it's been a lot of hard work, especially meeting a lot of resistance here and there. With our community, for those who might not be in Uganda, there's always that question of accountability. Who is involved with this campaign? Where is the money going to go? And I just wanted to encourage those who might be watching us that, look here, the whole idea is to make sure that we provide oxygen concentrators. The majority of the people who are passing away in Uganda are dying because there is a lack of oxygen concentrators in hospitals. Right now, I've been watching and seeing stories where even oxygen cylinders are being hoarded, whereby if someone knows someone who has passed away, they're using the oxygen cylinder as bait, or call it bargaining chip, to make sure that the next person who is critically ill can either pay the highest dollar or shilling to get that oxygen concentrator, oxygen cylinder. So that's the kind of situation we're dealing with. And I think it's very important that people know that this is a situation that is going to affect, if it's not affected you already, your family, or indirectly someone you know will be affected by it. So I do encourage people to give. The campaign that Susan Namulindua is spearheading, if only we got at least 1,000 people each giving $200, I feel that would be over the crossing, pretty much a finishing line in no time. So my encouragement is that even if you can't give $1,000 or $10,000, it's important that people come and contribute to this. Now, Moses did mention that one of the functions I attended here, the parent happened to have introduced me to a young man who happens to be the aide of Chuck Schumer, the Senate Majority Leader in Washington. And the gentleman I met, Rodney Kazibwe, works for him as one of those foreign aides in Washington. So he said he would want to see how we could help. And one of the things in our discussion of record, I did mention that it would be good for him to see what could be done, especially with the company, which is New York based in terms of the manufacturing of oxygen concentrators, to see how we could actually help to get some of these units to Uganda. The other people that I met, believe it or not, the Mass General Hospital in Massachusetts has been sending a team to Mbarara Hospital. So I met Lindsay Martin, who led part of the team, and she's also done great in introducing me to the director of global nursing at the Mass General Hospital, who prior to getting to this meeting was not able to get to me in time, but I'm sure subsequently we're going to make connections because all those introductions have been made. And I think the whole idea of what we're trying to do here is that we're not necessarily trying to send money to Uganda, but if we can buy items, be it PPE, oxygen concentrators, and based on what those doctors who went to Uganda and to Mbarara told me, that some of the biggest challenges they face, because I did reach out to one, and in her testimony to me, she told me that the biggest thing people are dying from is the lack of oxygen. But the one thing that affected her, one of them was the fact that while they were helping one of the people who was transitioning to their next life to pass on, the doctor in Mbarara, one of the accountants came and handed them a bill. And while someone's body was even still warm, so she felt that that was a little traumatizing, but that is the reality of where we are. So these stories, you know, and then they're even really sad ones which involve health workers who have died and then bodies have been hoarded whereby they won't release them until the money is paid. They're such painful stories out there that unless, you know, we could sit back and wait for the international community and COVAX to give the vaccines. But I think it's important for us to step up. We who are in the diaspora and can do something. I feel that a campaign like this gives us the opportunity to do that. So two things: if you can actually buy one oxygen concentrator and make sure that it gets to Uganda, support what Moses and Susan are doing, go ahead. If you can actually give $200 or $100 towards this cause, remember the money will be converted into buying the oxygen concentrators and the PPEs. No money is going to be sent directly to Uganda. So I think it's very important that people know why we're here and why we're supporting this cause. And we as Uganda Diaspora Network, we've pledged to put this information out there and also to be a part of it in every way possible. And with that, I would like to thank Moses, Susan, and all the people, the High Commissioner, Margaret Yugiri, who has been very supportive, but above all, Dr. Daniel Chabayenze, who has really lent us his time and also coordinated everything with the Ministry of Health, the PS and the Minister to make sure that we get the support and the goodwill we need to move forward. So thank you again for the friends of Uganda who are on this call for everything you've done. Thank you so much, Patricia.
Thank you so much, Ronnie, and condolences for the members of your family that you've lost due to COVID. Now, you know, Ronnie did say that we're looking for 1,000 people to give $200 for us to reach the goal of the $200,000, which will be used to purchase oxygen concentrators to be sent to Uganda. Or we need 200 people to give $1,000. I do know that myself and my family, we are donating to this cause as well as the Transformation Institute. So if you're watching this, even if you're not watching this, share it with friends and family members, because as you know, we're all connected. Whatever's happening elsewhere in the world, eventually it's going to affect us wherever we are. And, you know, Moses did say something about the brain drain earlier on, and I know that eventually we'll all suffer as a result of COVID if we do not come together to support each other. Now, at this time, we have a very special person joining us. He's, you know, a lieutenant colonel, a flight surgeon in the United States Air Force. And he's going to be speaking about the impact of the COVID-19 virus. I mean, the long-term impact. It's my pleasure to invite Dr. Ivan Edwards. Thank you so much for joining us, sir.
A pleasure. It's a great pleasure. I'm Dr. Ivan Edwards. I'm a medical doctor, and I live in the United States. I also happen to be in the Air Force Reserve. I'm a flight surgeon. I like to have a disclaimer. Every word I say are my own words. They're not the words of the ideas or reflective of any government entity. I see a lot of patients that have had COVID here in the United States. And I feel, and this is what a lot of people feel in the medical field, COVID is not going anywhere. So even after people are healed, we are going to see a lot of patients come and see us with post-COVID syndrome. And that can be manifested in different ways and forms. I've seen people who have brain fog and cannot remember. I have a patient who simply cannot remember what he is going to do or what he's supposed to do at any given time. So he's relying on his wife to help and guide him. And his career is at jeopardy. He's at jeopardy of losing his career. So that is important to remember that. There's a lot of things that have been said which rhyme with what I'm going to talk about briefly. The multi-pronged approach is very important. We know the benefit of masking, hand washing with water and soap, the social distancing. Sounds simplistic, it works. Now, what we have to do, though, is to look at one thing that COVID has done that practically no other pandemic has done. It has revealed the socioeconomic fault lines that are global. What do I mean by that? And that has been touched on by a lot of people here in the panel. We see a lot of people who are disadvantaged people from a lower social and economic status being affected more than others. For those people who have a higher education, people who have higher means, they are affected, but they have access to treatment and they can afford to get on a plane and come to New York or Ottawa and get the best treatment they can get. Or they can stay in Uganda and get the best treatment or come have a private doctor come see them. Now, I was born in Uganda and I have relatives in Uganda. I have lost so many relatives, I've lost count. So my own brother got COVID and his wife and his daughters, and he almost died. So that is rampant. It's all over the place. So I get calls constantly about what's happening in Uganda, and it's dire. We have to do something about it. So this goes on to that topic of the socioeconomic fault lines that COVID has exposed. Yes, we need to educate people. Education is key, because what's happening is that what we know right now about COVID, obesity itself is an independent risk factor for COVID, regardless of age. So if somebody is 14, 15 years old and they are obese, they are at risk of getting severe COVID manifestations and even post-COVID syndrome. So we see that. What we need to do then is to educate people, and obesity is rising in sub-Saharan Africa and in Uganda, because the concept of being obese in Africa, and all of us know this. I was born in Uganda, I am Ugandan, we know this. The concept of obesity is if you are heavy set, it's a sign of social status. You have arrived, you have achieved. If you're skinny, it's worth it. I mean, we know that. But we are extolling obesity, but we're forgetting that people are increasing their risk of getting COVID and even severe manifestation of the disease. We have to educate people. It is not cool, it is not safe to be obese. We have to work on the weight problem. And why is that happening? Because it is cool to eat a Western diet in Uganda. I like the traditional food, which is plant-based. But we've been assaulted with foreign diets, and a lot of even the small middle class in Uganda is gravitating to those diets and to the lifestyle, unfortunately, of the West, which is contributing to obesity, a hike in obesity. We need to address that through education. We also have to look at the parallels that were brought up. We've seen people here in the United States and in Canada, and I dare say in Uganda too, because as I said, these fault lines have been exposed and COVID has done just that. What we have seen is that in disadvantaged groups, people have to go to work, and they work in service-oriented fields, in factories. And the concept of social distancing then goes out of the window because they have to work to provide a living. And what happens is that they don't have opportunity, and they also live in dense housing. Dense housing. So, and Uganda being a communal state, a communal society where people are living close to each other, and people are, most of the people don't have jobs where they can stay home and work from home. They have to drive a matatu, a boda boda. They have to do something to survive. They have to sell something on the streets that involves being close to other people. Education to provide proper access, education to provide opportunity that will address the social inequities, education that will address the economic inequities. That has to be addressed, because otherwise we're putting a Band-Aid. This is not going anywhere anytime soon. We need to give money to get help for those who need help. Concentrators, we need to do that. We need to do that. I suggest and I challenge that each one of us should also look long-term and say, what are we doing to, because this is going to, yes, people will recover, but what's going to happen to people who recover? They're going to have post-COVID syndrome. And who are they going to see? The doctors there, and I ask and I challenge the doctors, my colleagues, that post-COVID syndrome is difficult to treat. Somebody's going to come in with paresthesias in one hand, has no concept of taste or smell. Somebody's going to come in and they're going to think, he is crazy, he's cuckoos. What's wrong? Somebody's going to come in with pain that does not quite meet what we've read about in medical textbooks. But we have to address these issues. So we need to educate people. Yes, this is how COVID is spread. These are the risk factors. Obesity has to be addressed. Yes, the socioeconomic fault lines that COVID has exposed, education has to address those so people have access and opportunity. Because without access and opportunity, without social redress, without any kind of economic redress, they are going to clamp on each other. Yes, they might get vaccinated, but those who refuse to get vaccinated are going to go in the same taxi, in the same matatu, or they're going to go on a boda boda, and they are going to be close to one another. And they live in housing with extended families, because that's the way the tradition works. So we have to do a good job at educating our people. Very important. And another thing is, as you know, post-COVID has the COVID long haulers. And those are the new ongoing symptoms that people express or manifest, where people have fatigue. I'm seeing a lot of people with fatigue. They've been healed, they're walking, but they cannot function in their jobs because they're fatigued. And people who also have pains, joint pains, or who have problems sleeping, or people who have brain fog. Those things are happening now. And we have to think long-term as well and find out, what are we going to do when that happens? Again, that's a part. We also have to think of the long-term effects. There's what we call critical illness myopathy, where somebody's completely weak. And I've done biopsies. I've had biopsies on muscle tissue of people who have COVID, and some of them, the tissue is damaged. The muscle tissue is damaged. And I've sent some to cardiologists who have told me that this patient has inflammation of the cardiac tissue and has to be monitored every 3 months. How is that going to be done in Uganda? We don't have imaging in Uganda. We don't have an infrastructure in place to address that. Do we have it in sub-Saharan Africa? I don't know, and I don't think so. What are we going to do about it? Well, we can start. We have to have a starting place. I will share something that before I leave, something that is part of my call to action. And there was a man, he was passing away, and he requested for me to come see him. No, he did not have COVID, but he told me something. He said, as he was losing his life, as he was losing his ability to breathe, he said, don't just. and he passed. I held his hand, and I asked myself, what was he trying to tell me? Don't just. I went back home and I looked up "don't just," and I looked it up. It is a wonderful, wonderful piece that Roy T. Bennett wrote. Light in the, I think it's light in the heart. Yes, light in the heart. Don't just learn, experience. Experience. We have to experience a lot. We have to make a difference count. Don't just read, absorb. Absorb. Let's take that magical time. We are going to, and we have to change thousands of lives of people that depend on us. Don't just change, transform. Don't just relate, advocate. We are advocating for people in Uganda who need oxygen. I appeal to each and every one of you listening. 1,000 for what? For 200 or 100 for 1,000, whatever it is, give. If it's $5, give. 10, 20, 50, 100, whatever it is, 1,000, 10,000, give. I know all these panelists, we are not going to pocket any money, no proceeds. They're going directly to the work that they're supposed to. Don't just promise, prove. Don't just criticize, encourage. Don't just think, ponder. Don't just take, give. Don't just see, feel. Feel with us. Brethren, feel with us. Brethren, everywhere you are listening to this, feel with us. Feel our heart, our pulse. Feel my heart and my passion for the people we are out to protect. We are here. We're taking time off our schedules because we care. Don't just see, feel. Don't just dream, do. Don't just hear, listen. Don't just talk, act. Act, act, act. Don't just tell, show. Show that you care. Show that you really care. How? We have to give. Don't just exist, live. So what this dying man left me was this piece. Don't just. Held my hand, and he died. Thank you. And may God bless each and every one of you.
Wow. I mean, I feel like jumping off my seat. Thank you so much, Dr. Edwards. First of all, your accent is so American that I can't even imagine that you're Ugandan. But, you touched on some very important things that we have not thought about. The long-term effect of COVID and the importance of staying healthy, the importance of being present in this moment, and not just being present, but living in the moment and experiencing the moment. I think Mama Watali and the Transformation Institute, we have to organize an event where we bring Dr. Edwards to educate, the community, because I think what he has to share is far-reaching and will really make a great impact. Thank you again. Really appreciate it. And for you watching, don't just listen. Don't just watch this. Do something about it. Move. And don't just give reasonably. I would like to especially thank a few people right now, Dr. Steve Gupta and Sojit Babra, who led the efforts to send the oxygen concentrators to India. They're supporting this effort, not just helping to show this group how to acquire the concentrators, but they're also giving out of their own pockets as well. And that's really commendable. So if you're watching this, jump on, be part of this effort. You've heard, from some of the panelists who've lost their family members. Our time is fast spent, but we'll just be able to take a few questions from the panelists before we go. The first one is to Dr. Chabanze. I would like to ask, what are some of the critical things that can be done by the West to help, alleviate the situation in Uganda right now?
Survivor. I also contracted COVID. I was treated and I'm okay. And I want also don't just look. I also want to positively contribute. one of the things which we could talk about as health workers, we need a lot of protective equipment. It is usable, it's reusable, it costs little when you're purchasing, but it goes a long way to help. We also need the high voice. You've already mentioned Moses in his remarks mentioned, and everybody here said the vaccine inequity. We are at the 4 point and we need a multi-pronged approach. We need you to advocate for us to get the vaccines. Uganda has the money to pay, but who is willing to help us purchase the vaccines? So we need a higher voice. It's not only the lack of money. We need the connections. We need to get the contracts to buy our own vaccines. So we're using the COVAX initiative, but it won't get us the vaccine in good time. Secondly, we need to educate the people. I think locally we have to do that. You know, we have people who can give health education, but now health promotion as a whole, you now see obesity and these lifestyle illnesses are going to give us a long haul for what we're expecting. But basically, when we get the equipment, when we get the lab equipment, we also need to get these testing equipment. We are buying the PCR equipment, very expensive to test. So all these need to help us. All these contributions will go a long way. So what, just Patricia to answer, what does Uganda need? Anything that can come our way everything is still in a low supply. And when we order things from wherever they're being manufactured, the transit is a long time. So some of these things need to be airlifted for us to be able to catch up. But we are excited that we have good friends and the good Lord is on our side. That's why the little success we're having to keep the few people who are critically ill still alive.
Thank you, Dr. Chabanze, for that. So you've heard him, so any support at all that we can give as individuals to be highly appreciated, and as organizations. Now, Dr. Edwards did mention, health promotion and health education as a very pivotal thing to do at this time, just to educate the population on some simple things that can help not just prevent COVID, but other diseases. But the new variant is actually, affecting young people, healthy people, and everyone. I'd like Dr. Ben to speak a little bit about this. What can be done? What is the most critical thing that can be done right now, to curb the new variant, the Delta variant?
Yeah, and again, I'll echo Dr. Edwards' comments that really this is a disease that initially in Canada impacted the most vulnerable, the people who were frontline workers in factories and healthcare, but is now affecting everybody. The variants do not discriminate based on age, based on comorbidity. I have treated young people as young as 16, 17 years old in the intensive care unit on a ventilator with COVID. It is estimated that 1 in 4 of people who are COVID survivors will be diagnosed with a mental health or psychiatric condition within the 3 months after. There is chronic weakness, chronic shortness of breath, chronic pain, chronic lung disease, chronic heart disease are all long-term consequences of this illness. It is absolutely very real. Now, as it turns out, the variants are very serious. They are more virulent, meaning they're more infectious. They are more likely to cause long-term sequelae or consequences of the post-COVID syndrome. Now, thankfully, vaccination is effective. It is less effective, but it is still highly effective for the variants. So the data that has come out in both the United States as well as in Israel has consistently confirmed that vaccination is very effective for even the variants. And thus the importance, as Dr. Daniel and Dr. Edwards mentioned, that really there should be absolute full-blown support to assure vaccine equity, to make sure that Uganda does have access to vaccinations for everyone in Uganda. That needs to be a priority, and all of us need to be advocating for that. In the meantime, until vaccination is available for everyone in Uganda, we will need to still assure that, number one, COVID is real. It needs to be taken seriously. And we need to be doing everything we can to assure that people are not contracting it. And that means social distancing, masks, hand washing. These things are simple, but very, very effective. And it's essential that we're doing these things in Canada. Even though most of our population is vaccinated, we still focus on the importance here to do it, which makes it even all that more important in Uganda. So.
Yeah, thank you so much for that. And I mean, based on what you're saying, I think that health promotion and education is very important at this time, you know, because some of the simple things you mentioned, hand washing and all that, even staying healthy can help put people in a stronger sort of position in terms of fighting the disease. Now, we are doing this fundraiser to send oxygen concentrators to Uganda. Dr. Kilby, can you tell us a little bit about the importance of the concentrators and what this will mean?
The concentrators are, you know, one part of the supports that are required in the treatment of someone who's become infected with COVID. I mean, many people can be treated at home, can stay at home and have no really significant symptoms. But those that end up in the hospital, in the emergency rooms, that need to be hospitalized, they go through different phases of the disease that can be from mild, moderate, very severe, and or end up in, you know, in the intensive care on the respirators. And at each one of those phases, you know, there are treatment interventions that are going to be required to support people through those phases, but are also going to be required in order to help those people avoid the acceleration of this cascade of events that happens within the body with COVID that can lead to total body shutdown, for instance. And so what we're trying to do is to bring as many supports, whether they be hydration, you know, for people, or pain management, you know, whether it's, you know, low level oxygen, which the concentrators can produce. Concentrators will take the oxygen levels to a higher level than what's in the room, not to the same level of oxygen as in the cylinders. So to understand that, you know, this is a measure that is used for people that are seriously ill, but not people that are requiring a ventilator. When you get to the point of a ventilator, you need to have the 100% oxygen that comes from the cylinders or comes from the central oxygen supply of a hospital. And so that's one point in terms of those. The other thing, as we've heard from others, is that, you know, we are going to get into a long haul post-COVID syndrome for many people. We've heard that some of them, yes, will have severe cardiac disease as it relates to that. Others will be left with scarred lungs and will be left with severe lung diseases, and they will require supplementation with oxygen, not at the level of the cylinder or at the level of, you know, that is at 100%, but that an oxygenator will be able to provide for them for maybe months, maybe years. And if there was no COVID, there would still be a need. There still is a need for the oxygen concentrators throughout our healthcare system for other chronic diseases that affect the lungs.
Patricia, I had a follow-up question from Dr. Kilby.
Yes, go ahead.
If you don't mind. Dr. Kilby, I wanted to get your sense of, back in Uganda, some people were talking about, you know, the oxygen that they use, you know, either for welding. Can you speak to the differences between the different types of oxygen out there, and maybe comment on the black fungus as well? Because those are things that have been attributed to COVID, and you guys being specialists on what the whole oxygenation process, sort of improving the oxygen in the room and all that, and what this equipment does will help to sort of help with everything. I wanted you to comment on that, and also to help understand that the oxygen that probably you guys use in ICUs is very different from what is out there. Just a comment on that.
If we are breathing room air, so no oxygen supplementation, typically that oxygen is about 21% of the air that we breathe in. But as the amount of lung tissue that is sick increases, the amount of required oxygen increases. So if we consider, let's just say half of our lung tissue is affected by an infection like COVID, for example, that means that it has less ability to absorb oxygen and that we need a higher concentration of oxygen in the air we breathe in order for the body to achieve its oxygen goal. So someone with pneumonia might not be able to survive on air that only contains 21% oxygen, as in room air. They might need air to have 80 or 90 or even 100% of the air we breathe in be oxygen. And so what an oxygen concentrator does, it takes, it allows us to be provided an amount of oxygen between room air, which is 21%, and 100%. So for as people are requiring more oxygen, as they're getting more sick from COVID or another respiratory illness, it's able to provide higher concentrations of oxygen to that patient to keep them alive. So it is really life-saving therapy. Now, Dr. Kilby mentioned it is one of the important tools in our arsenal of tools that we use to treat people with respiratory illnesses. So from the point of room air to the point where they require a ventilator, oxygen concentrators are very, very, very helpful and very useful. At a point when the oxygen concentrator is insufficient and we need a higher level of oxygen, that's when we talk about potentially that patient needing a ventilator. But thankfully, most of the patients we see with COVID require supplemental oxygen, and thankfully, the majority of them are not progressing to the point they need the ventilator. So for the patients who are hospitalized with COVID, most of them, the oxygen concentrator is really the life-saving therapy that they need.
Thank you so much, Dr. Thompson, for clarifying that. Now, I do have some more questions, but time is fast spent. So...
Question, Patricia, sorry.
Okay.
Dr. Chabaize, I'm sorry, I'm mispronouncing your name, shame on me. I know that it's a big job you are doing managing COVID. I'm just wondering whether it is possible, if it's not already done, if it's possible to fit in sensitizing some community leaders about, for example, fear of vaccine. I know some people whom I love very much in Uganda, and they swear that they will not take the vaccine because they believe something or other, some devil is going to be in the vaccine. And so I'm wondering whether it is possible to work with, for example, church or mosque leaders to try and talk to members of their congregations. And also maybe even as far as parish level to fight stigma, because some people, when they get COVID, they don't want to be asked, they don't want to ask to be taken to hospital. They hide it, and then that means they are going to spread it to some other people. I just don't know whether that is already being done or whether it can be done. Also, nutrition, because I'm born in a village, that's where I come from. And I know that in the village we have very nutritious foods we grow. There's katunkuma, bitter tomatoes and such things. But I don't think we always know how to benefit from them. So I'm wondering whether it's being done or whether it is possible to try and fit this one in.
Thank you very much. Just to highlight, we have a full-fledged risk communication pillar in the control. We have like 8 pillars. Risk communication is one of the key ones, because when you don't have any made biomedical intervention, sharing information and getting the people on board becomes the key driver for your intervention. Like we did for HIV when we didn't have any treatment, communication and risk communication and communicating to the lower person is a key. For instance, I do give talks on Radio Tech Show, like most of my colleagues. I do give talks to Rotary Fraternity, where they invite me to demystify vaccine issues and also do my colleagues. But I think we need to do it even in the lower different languages and settings, especially the Christians who are now having all these different ideas of what is in the vaccine. So we've demonstrated, the president has demonstrated taking the vaccine in full view of camera. Big businessmen like Patrick Bita-Toure, the minister, the permanent secretary, have all gotten their vaccination in public. So we move these pictures around. But I'll go ahead and say, I'm going to ask to purposely target the local leaders and the religious leaders and cultural leaders so that they take the mantle to educate their people themselves. I think they will believe them more and they will take their messages more seriously than all these skeptics they get from the people. They still have some fears, and true, even some health workers were hesitant to take the vaccines. That's how we've lost some of them, because when we go back in our records, we don't see them having taken the vaccine. Thank you, but I'll take that point forward.
Thank you very much.
Yeah, thank you so much, Dr. Chabanza and Ambassador, for that very important question. I think that's a very salient point to reach out to the community leaders, because vaccine hesitancy is one of the issues that I think it's really against efforts to fight COVID-19, especially in Africa, and the whole concept of COVID being a hoax also. I know people are still having weddings and funerals in some parts of Africa without social distancing and masks. I think if something can be done at the local level with the leaders, it will really help the situation. I'd like to thank all the panelists and everyone that joined the program today for participating. And I'd like to thank those who are watching and to implore you to be part of this, program, to be part of this effort to support the people of Uganda in this very trying time. As Dr. Edwards said, don't just sit back, don't just do nothing, don't just be a passive participant in the game of life. Make sure that you're involved and you're doing something. As Moses said, empathy is humanity's love language. Let's reach out today. We just need either 1,000 people to give $200 or 200 people to give $1,000. The goal is to raise 200,000, and I know we can do that, to purchase the much needed, oxygen concentrators to help the people of Uganda in this very difficult time where they're faced with the COVID-19 crisis. Thanks again for joining, and I would like to call on Moses at this time to give us the closing remarks.
I just want to take this opportunity to thank each and every one of you for being a part of this important conversation. And over the last about 4 or 5 weeks, I have hardly slept. This issue has bothered me. And I've had the opportunity, obviously, to connect with very, very like-minded individuals who have stepped forward to support this 100%. And we've had, Ronnie Mayanja, we've had Susan Namulindua, a partner in crime, so to speak, battling this COVID thing, from a distance. We're all the way here, actually, on this side of the Atlantic, and people are going through so much, actually, back home in Uganda. And I want to take the opportunity also, of course, to recognize Jimmy Sebulime, a dynamic young man, and who is so passionate and, a truly terrific, individual. And, Patricia referenced actually one of the statements that I had made earlier about the fact that empathy is actually, essentially the love language of humanity, right? when there are issues that bother people, that impact people's lives or their destinies, and we're able to just take a moment to do something about it, it makes a huge difference. And I'm kind of really emphasizing this to really, in essence, say that every one of us who's here, who's a part of this conversation, taking out time to really hear and to speak and to express and to take one or two things that eventually can be implemented, that really makes a huge difference. And I would like to encourage each and every one of us to continue to do that. To be honest, over the last, especially 1 week, I felt pretty discouraged. In fact, I even wondered whether or not to continue with the effort. And that is in part not because of my own will, which has remained very strong, but because of the burden that the calling seems to be putting on others, and that sort of thing. But the response that has actually come from everyone has been incredibly wonderful. The number, of course, other people that we've reached out, we've done everything possible, the response has been mixed. And that has been quite a disappointment, because sometimes just responding and just giving a word of encouragement and that sort of thing would actually be helpful. But I think the whole thing about giving up not being an option is very important to remember. Our goal is actually to wrap up the campaign for the oxygen machines by August 6th. That's just around the corner. But we've not gone to the point that we have so desired in order to acquire these machines. To let you know, about 200 units have been reserved for us. The price have been cut to almost half. And these are really high quality sort of equipment that would have made such a huge difference. And so if there's anything that you can do, if you know any philanthropists, or individuals who can just do $200, $50, whatever the amount, let it happen. Because at the end of the day, not only will it save lives from COVID, but like the experts have said, it will make a big difference in some other ways as well, in terms of other kinds of treatments. And so the other point that I think is very important is that we now have a clear channel of communication with the Uganda Ministry of Health, the officials there. So there are some other ideas that Mama Watali, the Transformation Institute, and also Chacha and so on will be able to potentially consider. Whether it's public service announcement ideas or, sort of certain campaigns that may be possible, because we are also in the media, right? So there are some, initiatives that could potentially be far-reaching in terms of the impact and that sort of thing. So we'll be very happy to have that conversation. And then the last point that I would like to make is that as noted, the government of Uganda actually put aside some money to even buy the vaccines, but the vaccines are not even available, right? And it really broke my heart when I actually saw, on the news a couple of days ago that, some of the vaccines that Canada had actually acquired had expired. And these expired vaccines, were to be actually thrown out. And I actually was like, what on earth, because if there was some sort of planning and strategy and so on, perhaps, these vaccines could have actually been shipped earlier, to make a difference back home. And in a conversation actually with Dr. Ivan Edwards, who had the opportunity to reach out, to, I think it's Pfizer, the vaccine manufacturer. Apparently one of the challenges that has been apparent that made it rather difficult for, for Pfizer to consider supporting the efforts in Uganda is because of the fact that the vaccines that they make require certain kinds of conditions, particularly refrigeration and so on. And really this goes a long way to let you know the people whom we have on this panel, how far we have even on individual basis gone. Dr. Edwards actually contacted Pfizer to ask for this donation or something, and apparently Pfizer was actually willing to do something, but the concern was how these things would be transported and kept and that sort of thing. So I think we should consider perhaps rethinking long term, and I really echo a message that I had received from Dr. Ben Thompson about the fact that we really need to have some of these conversations ongoing, not to wait until we have a pandemic or a difficult situation like this, but to see what else is possible from a strategy viewpoint and that kind of stuff as well. And in closing, really, I am kind of on cloud 9 because the fatigue, all of the feelings that I had, in terms of, the slow progress and so on, that kind of has evaporated because of the energy that's bouncing off, from you to me and all of that. And I sincerely appreciate that. And I also want to encourage, Dr. Chabainze to share with the folks in at the ministry to be more open-minded in terms of the strategy. Because if the government can have potentially millions of dollars to buy vaccines and the vaccines are not available, and potentially the money is sitting there, and here we are hitting our heads to trying to raise just $200,000 to buy oxygen concentrators, it may have just been easy to make arrangements to have these things bought, maybe 500 units. All of the hospitals there would actually have more than enough, to make a big difference. So we need to kind of rethink how we want to approach some of these things, in order to be able to make a profound and significant difference. Because tapping, people of goodwill such as Dr. Thompson and Dr. Kilby, and then members of the Ugandan diaspora as well, to do something that can be really transformational is much, much easier if we can broaden our thinking. And thank you very much.
Thank you so much, Moses, and thanks again to everyone that participated in the panel, and for those of you who will be watching this on social media or through other media platforms. I'd like to especially thank the Redeemed Christian Church of God in Canada, because they generously donated, I believe it was $10,000 to this. That's really encouraging. And if other churches out there, organizations, everyone can join hands within an hour or less, we can raise this money, because time is of the essence. Time is of the essence. People are passing away as we're speaking, actually. So the earlier we send the machines down to Uganda, the better, and lives to be saved. So I like to encourage you once again to be part of this effort to support the people of Uganda. And I thank you in advance for that. Don't just look, don't just listen, do something about it. Dr. Edwards, I'm going to do something about the don't just thing, because I think as human beings, we need that message. We shouldn't just exist, we should experience and be part of things. So please don't just look away at this moment, be part of this. All right, do take care, and God bless, and God bless everyone, and people of Uganda especially.